Hello, delegates. We meet again by not meeting. We're in the world of these days, aren't we? We've got the virus, we've got variants, we've got vaccines. I hope you're doing well through all of that. And I just want to say, I think I've said this to you before, but I want to repeat it because it's an important thing to say. We owe you so much. We owe our healthcare workers right across this country so much. In all of the capacities, all kinds of healthcare workers, we owe you. You've worked yourselves into exhaustion. You've put yourself on the line. You've risked your lives in a very sort of direct way, unfortunately, and it's all for the people that you serve, the public. And we owe you. There aren't words that can adequately express how important you have been to us and how valued you are. And that applies in a different way to Val in the sense that she hasn't been where you've been on the front lines of delivering healthcare, but she has been so important to the struggle in BC and across the country. Your outgoing president, I'm sorry to say. She's been a great president for you. And she's been a great national board member for us. A wonderful job of chairing the Canadian Health Professional Secretariat. And people talk about the burdens of leadership. And leadership is always a challenge. There's no question about that. But sometimes, and sometimes more than it should be, it is in fact a burden. It's a heavy load and it's a heavy responsibility. And Val, you have carried that load and that responsibility so well. You've been totally committed to your members, totally committed to HSA. You deserve the right to stand down with our thanks and with our gratitude. And we'll welcome, before the end of your convention, we'll welcome a new president to our national board, and we'll stand ready to help that new president in any way that we can. The pandemic has showed us how much work there is to do in our society for a humane and people-centered society, which is what I think we all want. Inequality has been proven during the pandemic again to hurt people. It's just not an economic theory. It actually does damage to people. People who are on the bottom end of the income scale have suffered more from COVID. They've suffered more from job loss during the pandemic. It's gotten worse. Inequality has gotten worse. The other day I read, remember Stephen Harper, the Prime Minister of Canada from the ultra-right? He said that inequality has gotten so bad that it needs to be addressed. If Stephen Harper recognizes that, you can be pretty assured that it's gotten to be a huge problem. And we need to deal with it. We need to grapple with it. The pandemic has showed us how vitally important childcare is to our society and to our economy. People like you probably were told that you had to go to work because you were essential. And then the childcare systems that you'd relied on weren't there. And so you were told to go to work and you weren't told what you were supposed to do for childcare. And it's been clear right across the country that we absolutely need an accessible, affordable, universal, and public childcare system. And the pandemic has showed us that that call that we've made for years was exactly the right one. And so we've made some progress on that. And we've got a near consensus now, I think, across the country that we need to fix the situation in for-profit long-term care homes. The for-profit homes had the worst health records, they had the worst death rates, they had the worst staffing levels, they had the worst treatment of staff. And that's just unacceptable. The right to have a safe and happy retirement into the extended ages where you need care should be a universal right. It shouldn't depend on the size of your wallet. And so it should be a part of Medicare. And we've been fighting for that, fighting hard to bring it under the Canada Health Act, and I think we're making progress there as well. The same with home care. There should be a seamless system of care for elder people and people who can't look after themselves for whatever reason, whatever age. And it should start with home care and it should move on to long-term care and then into acute care. And we don't have a home care system. We have a series of systems. We have piecemeal, we have for-profit companies. We have too many different ways to deliver home care. We need a system that's public, universal, and affordable. And we've had a pandemic within a pandemic. And it's one that we saw coming, but we, I think, are making progress in getting attention to this pandemic, and that's the pandemic of domestic violence. We knew it would get worse. Stress, alcohol abuse, the isolation of people in their homes, we knew it would get worse, and we were right, unfortunately. So we've been pushing hard for a national program to actually address domestic violence, to support women who are the victims of domestic violence. And I think we're starting to move the needle on that. I think we're getting some progress there as well. We've had another crisis within a crisis that you know about too well in BC, and that's the overdose crisis, opioids and other drugs. We've been working hard with our activists. We picked up that challenge again just recently, and we're working as hard as we can to bring attention back to that crisis because it hasn't gone away. It's just been kind of under the surface while so much attention was paid to COVID. And we've known that racism has been a problem in Canada. It's sort of comfortable to think that it's a problem in the United States, but that's not fair. It's a problem in Canada too. And the issue again came to the fore with the pandemic. Racialized communities suffered more from the pandemic than anybody else. And racialized Canadians were hit harder by some of the income problems as well. And I want to, at this point, I want to just stop and say to HSABC, congratulations on that wonderful groundbreaking work you've done on dealing with racism faced by your members, on what your union should do about it. That's been a wonderful program, and it is a model that has been copied across the country, so congratulations. And as we come out of the pandemic, we will eventually come out of the pandemic, we're going to be facing right across the country calls for austerity because the government spent it all on COVID, and what could they do? They have to now cut, slash, and burn. And that's absolutely the wrong answer. It's a dangerously wrong answer. We need the opposite of austerity. We need to shore up our defenses against the mindless call for cutting government spending when that isn't the solution at all. So those are some of the things we're working on. Val can tell you, Miriam can tell you, that's really the tip of the iceberg. There's a lot to do. And you with Val have been, when she's been at the helm, you played a very strong and positive role in all of these struggles. Struggles really for a better Canada. So we now look forward to working with a new leader. We look forward to continuing all of that really important work together. So have yourselves a great convention. Thanks for listening.